Hi there, how are you?
I'm well. How are you?
Very well, thank you. Now, Dr. Brightman, where are you originally from?
I'm from New York.
And where do you live now?
I live in New York.
You. Very
Yes.
good. Okay, can you please tell me a little bit about your educational background?
Sure. So I think I always knew I wanted to be an OBGYN. For college, I attended University of Pennsylvania and received my MD degree from the Mount Sinai School of Medicine in New York City, where I subsequently trained to become an OBGYN. And I've been in private practice for 28 years on the Upper East Side of Manhattan.
And so that you work for yourself right now.
I work with two other women. Yes, we have an all-female practice, and it's just great.
Now, what is endometriosis?
So endometriosis is a condition, it's one of the most common gynecologic problems in America. It can affect 1 in 10 women, and it's a disease that's characterized by extreme pelvic pain, painful periods, pain during sex, sometimes painful urination, sometimes painful bowel movements.
Now, this has been in the media quite a bit lately, with a few celebrities
Yes.
coming out to talk about their issues with this.
True. Several celebrities have shed light on this, and with this, I'm currently working on the campaign SpeakENDO with Julianne Hough, who's been outspoken about her diagnosis. And really, I think the two of us have been working together to increase awareness amongst women who have endometriosis or women who may have endometriosis, that it's important for them to speak up because there's frequently a delay in diagnosis of this condition. And the most important thing is to really be accurately diagnosed so a course of treatment can be outlined.
Now, with all things gynecological, it seems like women aren't always the most open with their doctors about these kind of problems, and that causes more problems. So, what are
Correct.
some questions women should ask their doctors?
So I think women really need to come in with a list. Doctors' appointments these days tend to be very short and brief, and as doctors, we can't read minds. So I think women who really have debilitating pain that's interfering with the quality of their life, need to speak to one another. And if they have any questions, I'd suggest they check out the website, SpeakENDO.com, because there's actually a short quiz they can take to see whether or not their symptoms may be related to endometriosis. And the best thing a woman can do is come to their healthcare provider prepared with a list of questions and concerns so that they can be accurately diagnosed. And as I mentioned, the course of treatment can be, determined that much more quickly.
Now, how can women better explain these symptoms to their doctors?
Well, again, by seeking adequate resources through SpeakEndo.com, the website really will go through a list of symptoms. Women can listen to the true stories of other women and then really write down a list of questions. Be prepared for, these appointments with their healthcare providers, and that way the dialogue can get started.
But along the lines of, I'm having some pain when, or is this normal? Are those the kind of questions that people should have in mind?
Absolutely. I'm having pain when I have sex. I have terrible pain. I can't go out when I have my period. That's not normal. And these are the concerns, amongst other things, that they should talk to their doctors about. Because
Now,
as doctors, we don't always know when to ask these questions.
what is Speak Endo?
So SpeakENDO is an awareness campaign to increase awareness amongst women who have endometriosis or women who may have endometriosis. Because the more women share their symptoms with one another, the more they will be aware and take their symptoms to their healthcare provider and hopefully be diagnosed earlier, because it can take the average woman with endometriosis 6 to 10 years before the diagnosis is accurately made.
That's a long time to be in.
Very, very.
What inspired you to get involved with this campaign?
Well, this is an important and very common gynecologic condition, and I think that it's really important that women speak out. Again, as healthcare providers, we are not clairvoyant. We don't necessarily know what a woman may be suffering through on a day-to-day basis, and I feel that it's really important for women to advocate for themselves, and if I can in any way help with that, it's my joy to be able to do that.
What advice would you give to a woman who thinks they may have endometriosis?
Don't be silent. Speak to your friends, your boss, your colleagues. Speak out, particularly to your healthcare providers, and tell them, voice your concerns. Say, hey, I may have endometriosis. Can we talk about this? Because otherwise, healthcare provider may just be thinking someone's there for a regular exam and to totally gloss over, debilitating symptoms that a woman may actually have.
Now, one other kind of medical question along the lines of endometriosis, does it cause infertility?
Well, endometriosis can be associated with infertility, but not all women with endometriosis have issues conceiving.
Thank you for that piece of information. Now, where can people learn more about you?
About me? They can learn about me by visiting my website, eswobgyn.com, or visiting SpeakENDO.com, where they will actually be able to find a physician who can help them with their endometriosis symptoms.
I was going to ask that next, where people can get more information on SpeakENDO.
Through the website, and also by sharing the conversation, by sharing the hashtag SpeakENDO.
Wonderful. Well, thank you very much for this information, Dr. Brightman.
Thank you.